morning. My name is Joshi Alumkal. I'm an assistant professor of medicine at Oregon Health Sciences University and the Cancer Institute. I'm a medical oncologist who focuses on prostate cancer research. And this morning we'll be talking about our poster presentation at the EMUC meeting in Barcelona on the novel hormonal agent TAK-700. In recent years we've seen really a demonstration that male hormones remain active and important in tumors that are growing despite medical castration. And we've seen several new drugs approved that fall into this category, enzalutamide and abiraterone. The drug we're discussing today, TAK-700 by Millennium, is another example of that type of a new potent hormonal therapy. And it is a lyase inhibitor and works by reducing production of male hormones. And is effective even when tumors are resistant to castration through surgery or medical treatments. The poster we're presenting today is focusing on a growing group of patients who have PSAs that are going up despite medical castration in the absence of metastatic disease. And for that group of patients, there really are no known therapies that improve survival. So in this phase 2 study that was conducted through the Department of Defense Prostate Cancer Foundation Prostate Cancer Clinical Trials Consortium, we were testing TAK-700 in that group, in that precise group of patients. And the results demonstrate that there was anti-tumor activity with the TAK-700 compound. And that's evidenced by both reductions in PSA, greater than 50% declines, in addition to many patients having greater than 90% PSA declines. While this was a single-arm study without a placebo, there was a progression-free survival shown here on this curve. Shown here on this curve of about 14 months. And many of the patients who were enrolled in the trial had very fast PSA doubling times and aggressive disease. And while again we don't have a comparator arm, this degree of progression-free survival certainly is encouraging. Interestingly, although this is a drug that reduces male hormone production within the adrenal glands, unlike abiraterone, which requires that concomitant prednisone be prescribed, in this study with TAK-700 we use a dose where prednisone was not given, and that was found to be safe without a lot of additional toxicity related to adrenal insufficiency. Currently, additional studies are ongoing which use a higher dose of TAK-700, in which case prednisone is required. But in some of those trials, and certainly if the drug gets approved, the information from this trial with a lower dose will give us good confidence that if we need to dose-reduce patients, that a lower dose of TAK-700 may be used with anti-tumor efficacy, and that we may obviate the need for prednisone with this lower dose of TAK-700. So again, these are early findings. It's a phase 2 clinical trial. The development program and the phase 3 program with TAK-700 goes on, and we await the results of those clinical trials. But we can certainly say that this is a new and active drug, and a promising drug, that we hope one day is added to our armamentarium in the treatment of advanced prostate cancer.